Hey everybody, it's Corbett. Sorry these episodes have been slow coming for the past year, but you may have heard my family and I have been touring the US, teaching building performance and making a TV show about it. Now, I don't know if it's obvious or not, but this show is and always has been just one guy with a microphone. I don't have any staff, support, or sponsorships for this. And after producing 80 episodes, I know we have over 2,000 subscribers in countries all over the world, but I rarely hear from you guys. If you have 2 minutes, please do me a favor and go to iTunes and review this show if you're not one of the 27 cool people who have already done that. I'd really appreciate it, and I love to see that continuing to make the show makes a difference to people. Thanks for listening. This episode is sponsored by my Tiny Lab, the world's highest performance tiny house on wheels that I built with my mom and dad. You can see videos of our design, construction, testing, US tour, and our adorable baby at my YouTube channel called Home Performance. Enjoy. Welcome to the Building Performance Podcast from the Building Performance Workshop. I'm Corbett Lunsford from the road on the Proof is Possible tour, and today we're talking about trends in high-performance building and retrofits from the medical angle, which sounds a little funny, but you're going to get it, with the one and only Dr. Gregory Melvin. Dr. Greg has been doing amazing things with infrared thermal photography on people. So first of all, Dr. Melvin, thank you very much for being on the show.
Love to be here. Thank you.
Can you please describe in kind of a succinct way what it is, what kind of magic you're making with thermal cameras?
Yeah, well, you're talking about that invisible ray, infrared, that basically that colored spectrum that we see with the rainbow has simply been applied to the body. And so when that representation of how heat from the body produces this consistency from one side to the other, which
from left to right, basically.
Yeah, looking from the right side to the other, the standard that is considered within the norm regarding people is that they should almost look like a mirror image of themselves on the other side. And so what this does, it gives us a specificity regarding how their body is functioning. Now, this is nothing new. I mean, Hippocrates, back in 480 BC, was already applying mud on the body to identify disorders regarding how quickly the mud would dry or stay moist. Both were significant of a disorder on the body. So it's really not a new technology. It's just been...
the technique has been refined since just using wet dirt.
That's right. Yeah.
So one of the things that you said was, and for somebody like me, and this is obviously a totally naive question, but I know that my heart is not in the dead center of my body. It's on the left. And I know that my intestines might be a little bit skewed to one side or the other, so I'm not a symmetrical person. But why is it that the skin on the left and the right sides should be the same temperature?
Yeah. Again, you have to know how the body is coordinated by a part of the brain that controls the skin temperatures, but also controls the blood flow to every muscle, organ, and gland. And so, yes, the organs are different from right side. We have a gallbladder on the right, you have a liver on the right, but a spleen on the left. They only become recognizable when there is a distress of that particular organ, meaning it has a change in blood flow that's coordinated by a part of the brain called the hypothalamus, which the skin and the central nervous system actually originate from the same fetal tissue, meaning your exterior, your skin, is hot-wired to a part of the brain that coordinates the blood flow to every part of the body. So when something goes wrong with that part, well, it creates an asymmetry, an imbalance of temperature from one side to the other, depending on what the pattern is and where it is, and it gives us an indication of what part of the body is being influenced. Is it muscular, or is it simply a vascular congestive characteristic, lymph congestive characteristic? Or is it a neuropathy, a nerve-related disorder, all generated from the same process of thermal imaging, where we're looking at multiple systems, but all at the same time. And so when you have an electrical system that controls that blood flow, if you have a short within the central nervous system on the spine, you'll see the short and its influence of that part of the body, like a condition like sciatica, which doesn't really tell you anything about why you have sciatica. It's just kind of telling you what it feels like.
And what's beautiful about your process, though, is that it is non-destructive testing, which is the same reason people use infrared on buildings.
Yeah. So you're not compromising. Again, this is interesting about Hippocrates, the Hippocratic oath, the oath regarding doing no harm to the individual is one of the premises regarding medicine, but apparently is not practiced very well today.
In Western medicine.
In Western, in allopathic medicine, where it could be with such a tool like thermography that originated doing breast imaging as far back as 1956 by Ray Larson. Dr. Larson and his papers regarding using thermography as a tool to identify risk factors regarding breast cancer is nothing new. But what has taken over is allopathic medicine, and radiology has taken over this viewing of breast imaging that obviously is not reducing the mortality of women. If you look at the statistics, it's not reducing the death in America regarding breast cancer. In fact, if anything, I would say it's doing more harm than good.
And we're recording right now from the Thermal Imaging Conference on the West Coast. And we've been talking a lot over the last several days in all different aspects of infrared about photon wavelengths and how they pass through your body or through a building or whatever. And we've got, infrared wavelength, we've got visible wavelength, we've got X-rays, gamma rays, etc.
Yeah.
And it's really interesting to be kind of marinating in this conversation about all of these different wavelengths, and then have you say, hey, remember, don't put too many X-rays in your body because it's doing things. As it passes through you, it has an effect. And in fact, you were saying that when you take a biopsy on breast cancer, is one of the main things that we were talking about in your class, you actually take the needle physically out from that biopsy, and you are spreading potentially whatever cells were in there.
Yeah.
And not potentially, you were saying definitely, you're spreading this. And it's just like, the body is a system, and I use that as an analogy all the time. Yeah. But having sat in your class and drunk from your fire hose, I realized that it's just lip service. I didn't realize what an incredible system the body really is until I sat there and listened to you talk about the gallbladder and the liver and the bile and the concentrated bile and the... in fact, will you just say for a minute, you were talking about the fact that breast cancer tends to favor the left breast and one particular place in the left breast, and why. And I just love for you to share that.
Yeah. This Mercola, Dr. Mercola, if you look him up in his background regarding cancer, established that statistically breast cancer 70% of the time occurs on the left breast. Initially, I think his thoughts were the application of deodorants was of issue, especially aluminum chlorhydrate, using things that stop you from sweating. Is that issue, which allopathic medicine, where if they're doing a lumpectomy, is there any concerns regarding what they're putting on the armpits? No. Is there any consideration regarding what they're eating? No. There is no considerations regarding what the person is doing, just what they want to do with the lesion. And obviously the process of biopsying seems to be of no concern of seeding or transferring cells when they do the process. And in fact, those women that have stage 0, meaning that they do a biopsy, that has no cancer, which is stage 0, the allopathic medicine is still emphasizing doing not only a lumpectomy, but doing a mastectomy on a cancer, a lesion that has no cancer in it, but they proceed anyway. not only doing a mastectomy, but doing a double mastectomy just to be safe.
And allopathic, just for those of us who are not hip to that term.
Yeah, that's medical. That's basically a medical profile of how healthcare is today. That's allopathic medicine. Basically, it's burning, killing, cutting, or drugging, chemo or radiating the patient in order to kill the cancer in spite of the patient.
This seems like a very American warlike, right? Like action movie for medicine. Yeah. So you had said that aside from the fact that it favors the left breast, it favors a certain quadrant.
Yes, and 70% of breast cancer occurs either at 12 o'clock, which would be directly above the nipple on the left breast, to 3 o'clock, which is directly to the outside. Now, that zone, that region, basically most of the blood and lymph is routed from the breast to the armpit, from the armpit to the neck, from the neck back to the heart. So this routing of blood and lymph with those that are right-handed, which most Americans are right-handed, thus heightening the risk when right arm dominant causes the muscles on the left side of the neck as a compensatory, a response to the arm dominance to create some type of balancing of the head and neck due to that dominance of right arm individuals. Thus, when those muscles around the neck on the left side, as they contract to compensate, well, they interfere with proper blood flow out of the left breast. So, what is the problem? Well, it's a muscular correlative feature that produces this vulnerability of breast cancer on the left side. So, you can do a lot of things, but until you change the tone of the muscles on the left, which are automated, these muscles have one goal, and that is to create a balanced cranium. So the head, if it doesn't sit as level as possible, your ability to coordinate your balance is predicated on the ability to level the head. So those muscles, you can massage them all you want. You can pamper them all you want.
Take some Advil.
Or Advil. It's those things. It's an automated process that if you don't change the overall structure, meaning from the bottom up, the foundation up, just like this, your home here.
The tiny lamp.
You have to level it so then you can orient yourself in a proper fashion. If you have it on a slope, then you'd be walking uphill to get up the stairwell, right? So your body has an automated feature to level itself at the cranium. The head has to be leveled as much as possible, so it has a balancing characteristic that it does every day throughout the day. And it does it even when you're sleeping. So those muscles, when you lie down, if they're already programmed to be tighter, they will be tight all night long. So when you lie down, much more difficult to get the blood and lymph out of the breast, out of the head, on the left side, simply because those muscles are overly contracted.
Because you're training them all day long.
They're programmed that way. And so when you lie down, now you don't have gravity. You don't have gravity when you're lying down to drain the blood out. So you're actually more vulnerable when you're sleeping with these muscles.
That is fascinating. So as far as the infrared camera goes, you are using it to not just see, like, for example, the difference that I say between a building or a home inspector and a home performance professional is a building inspector just looks at the static state. Yeah. Let's just take a picture of the person as they stand there would be your version of that. Yeah. But I thought it was fascinating to hear that you do what we do in home performance, which is to put the house on a treadmill. So, like, see what happens when the house moves and when it starts being lived in. So you said that you actually have people sit, lie down, walk with something, carry something, and you take pictures of them while they're...
we do still a static image where we do one sitting and then we do one standing to see how well are they acclimating to gravity? If they're having trouble with gravity, believe me, they're having trouble with everything.
Huh.
If their inability to balance themselves, to center themselves, they're going to have a lot more trouble in wearing out a hip or a knee or an ankle on that same side, simply because they're not centering the structure. So this processing with the aid of infrared, we use plumb line evaluation, pelvic drop evaluation, shoulder drop, even head tilt characteristics to see what does the body have to do to try to acclimate to what it is interpreting as being balanced. So it's almost like the system is short-circuited. It loses its identification of its center of gravity. This is the old Hans Selye, an MD out of Montreal, Canada, coined the word stress, but differentiated it between stress compared to distress, abnormal stress, where stress is normal. You should have a certain amount of stress. If you have the lack,
that's good for you.
If you have the lack thereof stress, then it's as bad as overly stressing the body, where you're wearing a part out. Yeah. So that physical activity, it's like a rubber band that it's meant to stretch, but within the tolerance of the rubber band. If you take it out of its tolerance, then it starts breaking down the fibers, and then it doesn't rebound back to its point of reference, which is a center of gravity.
So I kept coming back to the idea that your analysis of a person's body is so much more elegant than the American cutting, drugging, killing, and also that you could, you have a chiropractic background, and other chiropractors would take an X-ray to tell about the body's,
center
linearity and center and all that stuff. But you're able to tell with a much more elegant kind of hands-off systemic kind of approach, which I just think is so beautiful. Would you do me a favor and scare all of us a little bit by talking about cancer? Yeah. The fact that the body can actually cure itself or kill the cancer itself. You had said, let's talk about cancer for a second. Everybody has cancer. We all have cancer. Let's get over it. Because your body can fix itself.
It does every day.
Amazing.
Cancer has to have an environment to exist. It just doesn't come out of thin air, which allopathic medicine would lead you to believe that what determines that's in the cancer lesion, that area or zone, it predicates the perpetuation of itself. Basically, the severity of any disease has to have an environment for it to exist. Well, we're looking at what the environment, we're looking at the host, that would be you. And why would the body allow that environment for cancer to exist? Well, it has to have a proper environment. It just doesn't come out of thin air. Like in the old days, it was thought that you could create rats. How you would create it is you would put your garbage out, and you would create rats.
Wow.
That's the mentality that's being used today, that they're talking about the rat instead of cleaning up the garbage.
Mm. Yeah. And so when when it becomes a cancer that is not being able to be taken care of by your body,
aggressive,
you had said maybe not looking at things like what you're eating and eat more organic, or what kind of air you're breathing, things like that.
Yeah. Back in the day when Pasteur and Beauchamp, Pasteur had this wild idea that if you killed bacteria, that you would be healthy. Well, how's that working? Because you have to have bacteria in your colon in order for you to process. In fact, many of the vitamins and minerals are actually produced by what you harvest in your colon. So try killing it and seeing how far you go. You have to have bacteria. Just you want friendly bacteria, but you have to create, it's like the rats. You have to create the right environment. So then you create the right kind of organisms that are supposed to be there, which back then they used to call them wee beasties. This is what bacteria were called. The wee beasties, instead of just calling them bacteria, of course, they had to insinuate that this was something.
Evil little devils.
Yeah, they had the little devils that
trying to screw me up.
Yeah, that's right.
And so, if I suddenly decide, I'm going to eat all organic, I could be bringing no toxins from outside into my body. But you were saying that the way that my system actually processes whatever food I could be eating hot dogs, I could be eating organic romaine lettuce, but the process by which I am digesting those, right, could actually be poisoning myself.
Yes, and this is what it was the assumption when I was growing up, which, of course, I was born at home. I was never vaccinated. I've never had antibiotics. I've never had aspirin. Why? It's because we were programmed, like most, programmed that they have to have these things to make sure that they're healthy. Well, killing organisms or trying to instill resistance, your ability to defend yourself, is an inborn. You're born with that feature. It's just that we're thought if you eat right, if I ate the right foods, that I would be healthy. It doesn't guarantee that it processes the food properly. It was the assumption is that if you eat properly, that obviously that you would process the food in a proper fashion.
It's discounting the middleman, which is the bacteria, right?
Well, no, it has to do with how well controlled those areas and neurologically how well they're controlled. Those that are born with the aid of forceps already are traumatized at the beginning.
Why is that?
Well, you know what?
Aside from we just had a baby, so I'm already super pissed off at the whole hospital establishment. You don't have to get me started. But aside from just squeezing a baby's head with some metal clamps, is there an internal thing that happens?
Well, yeah, you're pulling on a part of the head and neck that frequently will traumatize the cord. So some of these sudden infant death syndrome cases frequently are attributed to what they did to the baby upon delivery. When you yank on a head like that and torque it to try to pull the baby out, well, the way the structure and the covering of the brain and spinal cord, it's got this Chinese handcuff covering. You know what Chinese handcuffs are? So you know how when you put your fingers in that tube, the more you pull apart, the more you stretch the head. It creates a compression, a chokehold on the cord that can affect the ability of the baby to breathe further on. So when you traumatize it, sometimes it takes a few days for it to swell. When it swells, then that communication regarding the common attribute of breathing, they can't breathe.
Yeah. Well, we could talk for literally 3 hours. And I know that you have a very busy day at the conference. So I'll just finish up by saying that I think that the whole concept of building performance, if you are listening to our voices right now, you have got to look more into this because Dr. Greg Melvin has this whole building as a system, home as a system, body as a system thing. Down pat, really, really interesting. If you are a home as a system kind of person, you've got to look into this. It's not about, feng shui and energies and stuff like that. It's actual science, really amazing stuff. Dr. Greg Melvin, thank you so much for your time today.
Thank you for having me.
I'm making sure that we're going to have you back on this. Greg Melvin is a doctor with a background in infrared thermography. You can find more about him at totalthermalimaging.com. You have been listening to the Building Performance Podcast. I'm Corbett Lunsford. Tune in next time.